Jodie Cook was appointed as the Public Advocate for Queensland in August 2012. With a background in psychology and 18 years' experience in disability services, Jodie is committed to driving change that upholds human rights and contributes to a strong and sustainable human services sector. Jodie began her career with 8 years in frontline service delivery and, having subsequently worked in a variety of government and non-government leadership roles, has extensive experience in policy development, project management, program design and practice improvement. Jodie will discuss recent advocacy efforts by the Office of the Public Advocate in relation to continuing deinstitutionalisation for people with intellectual disability or cognitive impairment residing in long-term health facilities. She will also highlight her concerns regarding the risk that service arrangements, both currently and into the future, may continue to perpetuate institutionalised arrangements. I've lost my place. To support, if not appropriately recognised and attended to. Jodie will explore practical ways that people with disability can be supported to mitigate against this by enabling them to be more actively involved in decision making. In doing so, Jodie will highlight strategies that may assist people to maximise their autonomy both now and into the future to facilitate a more successful transition to the National Disability Insurance Scheme. Please welcome Jodie Cook.
It scares me. I may have set myself too lofty a goal with that. Thank you, Michelle. Before I start, I'd like to acknowledge the traditional owners of the land on which we gather today and to pay my respects to the elders past, present and future for their very important role that they undertake as custodians of this land. When Michelle approached me to give today's presentation, it was really a question of how do I fit so much into what will end up, no doubt, being a fairly short space of time. So I'm going to try my best. Some of what I will offer are things that I think, and I was just saying in the break, I spoke at a forum a couple of months ago where I said much of what I say often comes across as naive. In fact, I say it because I have a never say die attitude. I think these things are possible. I think they can happen. It requires commitment and ongoing commitment of so many people to make them happen, though, and I think therein is the challenge. We work within a very complex environment, and certainly for me, being public advocate in this environment is a challenging time, to say the least. A bit of a background to us. Some people know about the Office of the Public Advocate, many people don't still, and I think that's part of that is because the office itself and the role itself became dormant for a period of time up until I stepped into it a couple of years ago. Effectively, our role is to undertake systems advocacy on behalf of adults with impaired decision-making capacity. We don't advocate at an individual level, and in fact the legislation says that I can't. But what we do is look at individual issues and the systemic issues that are behind those and see whether there's an opportunity to attend to those. I jokingly refer to the fact that I'm paid by government to tell them what they're doing wrong. It's a pretty good role, but still a challenging one in this environment. The population of people that we represent, as I said, are those with impaired decision-making capacity. We estimate that this year there are up to 113,000 adults in Queensland who may have impaired decision-making capacity. It includes people with intellectual disability, people with mental illness, people who are ageing with conditions such as dementia, and likely also a number of people who have other conditions that lead to impaired capacity, such as substance and alcohol misuse. So deinstitutionalisation. Interestingly, I worked for the department prior to coming into this role, the Department of Communities, as it was at that time, without the rest added onto the end, and was involved in particular in a project in 2010 and a very short space of time in early 2011 that was focused on actually moving people out of Bailey Henderson. Unfortunately, that project was washed away with the floods. So what began in a very positive way and what had a level of commitment behind it from government, the funding source that we had identified to enable us to keep going with that piece of work literally was washed away with the floods. My concern, I guess, with the change in government and having come into this role was that corporate knowledge that went with identifying that group of people, not just at Bailey but across all of the different institutions that still exist within Queensland, was going to be lost. And having sat down with Michelle around the table, we came up with a bit of a plan. And I guess looked at how we might be able to maintain that knowledge and in fact increase the awareness of this group of people within Queensland. So began our project. I guess took a couple of methods in terms of our methodology. We got sought data and obtained data from the Department of Health as well as the Department of Communities, Child Safety and Disability Services. Always have to think about that one now, DCCSDS. We also put out a call for submissions and received 21 submissions from people ranging from family members themselves to staff members to organisations in the community. I visited a number of long-stay facilities myself and had the opportunity there to talk to people, to not just to staff, but to talk to residents themselves and to get some insights into their lives. And in fact, unfortunately, Stephen's gone, but I did have the opportunity to meet with Stephen when I was at Jacana. I also talked to a range of other people who were interested, some of whom approached us, some of whom we approached, to gain their impressions, I guess, of the situation here in Queensland, but also to gain perspectives on what had occurred in other jurisdictions within Australia. Our findings weren't surprising by any means. We know that there were many reforms many years ago. We similarly know that they stalled in many respects from the late 90s onwards. The data that we received indicated that there were 271 people still living in institutional or long-stay healthcare facilities here in Queensland. I think those numbers are significantly underreported, and I don't know that it was a deliberate thing on part of government. In fact, I would say it's not a deliberate thing on part of government. I think the identification of these individuals just isn't there. I don't think that they are captured, and I think that's the essence or part of the issue in many respects. There were when we started the project, I guess we started with this broad focus of, people with intellectual disability living in healthcare facilities. What clearly came through as we got the information through the submissions, etc., was that there were two distinct subgroups within that. One were those people who had been living in institutions, many of them since they were young children. The other group was the group of people who had become stuck in long-stay health facilities as a result of a lack of, housing or support systems to get out. Most of those were people with acquired brain injury. So there's people who had come in more recently, I guess, than those institutionalised in days gone past. But, for the sake of not having sufficient systems of support and community, had remained stuck. Effectively, they'd become bed blocked. And again, I would reiterate the words I think that Neil and Diane Toohey mentioned before, that it's not for want of trying by the staff. You have very committed staff in all of these locations. They do the best with what they have. Unfortunately, they are where they are, and they are bound, I guess, in many respects by the rules that exist, the policies that exist within those environments. That in and of itself can be limiting in many respects. It doesn't have to be, however, and I think what we're starting to see is a shift in the tide. I don't think we're there yet. We're not seeing the tsunami coming, but I am starting to see in a couple of areas within Brisbane and the more regional areas some shifts where people themselves, and it's people. It's not necessarily the agency. It's where people are taking hold of this issue and choosing to do something about it, choosing to say why not, instead of coming up with all the reasons why it shouldn't happen. So the information was culminated in us writing a report, which we tabled in Parliament in November last year. And I guess since that time, we've been trying to keep the momentum going, trying to keep the story alive. And today's forum is another opportunity, I guess, to do so, to make sure that people continue to hear, continue to recognise, remain aware that this is an issue here in Queensland. We've also taken the opportunity to provide submissions to a number of different areas and to disseminate, I guess, the report quite broadly in the hope that others will see that and perhaps choose to act on that as well. I am pleased, and it was recognised again by Di, that there is a joint action plan that has been developed here in Queensland amongst the government departments. However, despite there being some action in that respect, it's not enough. We know that the services, the infrastructure that's needed out there in the community to enable people to move out doesn't exist. So while we can invest in a strategy that looks at the people, we can't just focus on the people alone. We need to look at the systems around the people, and we need to build those systems and make sure that they are adequate to support people in community. It can't just be a single funnel that does individual assessments and says this is what you need as a person. You then need to look at what those cumulative things are that people need and start to build those systems or start to identify those gaps in services or supports and make those things happen. As we know, the funding limitations that come with making those things happen continue to be an issue for us. But again, that's where that, if we build the evidence about what these issues are, the unassailable evidence that we know exists, and are in a position to put that before government, it demonstrates what can be done. And perhaps if we build that argument well enough, we can demonstrate that what needs to be done can in some instances be quite simple. One of my concerns is that even while there is some movement happening in terms of moving some people out, what we haven't done is plugged the gap to stop people being moved back in. And that's just as big an issue as trying to assist these people to be more active in community. If we move someone out of a bed here, but the next day that's bed's filled by someone else with very similar needs in one way or another, then we're just serving to perpetuate the issue. We're not actually addressing it. We need to cut off that influx of people, even while we're looking at how we assist the people who are currently there to move. Often that happens, and quite often that happens as a result of a crisis emerging in someone's life. It might be that their family members, elderly parents who have passed away. It might be that a behavioural incident that's led to contact with the police that then their system of support has said can't take them anymore, and that may not necessarily be a parent. It could be a service provider that goes, look, enough's enough. We've done it already. Whatever the reason is, unfortunately what then happens is that people are moved out of the area that they've been residing in, and they're moved into some other area, and often it's an emergency or crisis response. It's intended to be short term, but then what next? What happens is that people get caught in what was supposed to be a short-term location for the long term because there aren't appropriate options for people to be moved out. There aren't people who put up their hands and say, oh yeah, I'd be happy to support them. Or where there are, they're few and far between. And that's part of our challenge, I think, as well. As I've written at the bottom there, I think in many cases too, the person begins to build a reputation. Unfortunately, that reputation often is undeserved. It's not the person that is the problem, it's the system around them that has failed to understand them as a person and thereby failed to appropriately support their needs. It shouldn't matter whether a person has complex medical needs, whether a person has extreme challenging behaviours. We need to make sure that we're looking at the person and putting the person at the centre of any processes that are taking place in terms of looking at options for the future. That should be the same regardless of whether the person's needing to be moved as a result of a crisis situation or whether it's part of a planned move out of an institution and into a place in community. Most importantly, the person, and we need to make sure that the person is central to any decision making in that space. So turning the tide. Many of the instruments that we need to give us, I guess, the foundation to move forward already exist. As you would all be aware, and I'm not going to go through the convention by any means, but the convention itself tells us, or has brought with it, I guess, the new understanding about what disability is. Disability isn't just a standalone thing that exists. If anything, that's an impairment. Someone may be born with an impairment. They may acquire an impairment. Disability comes out because of the way that society fails to accommodate that person within its environment. It's from it might be as simple as someone with a wheelchair for whom there aren't ramps, as we were speaking to earlier, Jeremy, in your presentation. If there aren't ramps, or if the pavements on which someone is trying to mobilise aren't sufficient, then that area that person would like to get to has created the disability within them. I have a cousin with spina bifida who uses a wheelchair, and for him, his disability starts when he leaves his front door. Actually, it's probably more when he gets out of his car these days, because he's now got a car that's been modified. But his house is fully accommodated for him. He doesn't feel disabled within his home because it enables him to do what he needs to do in any way that he wants to do it. Similarly, he now has a modified vehicle that means he can get to wherever he wants to get to. But when he steps out of his car at the tail end is when his disability begins, because that's when the environment ceases to perhaps become as accommodating as his home and his car. There are a number of areas within the Convention that support people's decision-making rights, their right to be a legal person within the community, their right to have information available to them and to be able to express their own opinion in the way that they wish to do so. Similarly, within our Queensland legislation, the Guardianship and Administration Act makes similar provisions that are, in fact, quite supportive of people's decision-making rights. I think in some respects the issue exists where that legislation may not necessarily always translate into practice. There was a recent ALRC inquiry that submissions closed, I think, end of June, from memory, that is looking at equality, capacity and Commonwealth laws. While assuming that everyone has legal standing, some of the things that they hope to put on the table and perhaps get buy-in for are the notion of having a set of national decision-making principles. Those principles, I think, to some extent, or the ones that are being considered, are already fairly well supported here within our Queensland legislation. But I think what concerns me is that while change might be pursued at a Commonwealth level in accordance with this inquiry and any recommendations that may come out with it, and while there will be a recommendation that states look to adopt these things within their local jurisdictions, there won't necessarily be any push to do so. It'll be very much upon the states to make that call as to whether they do or not. So talking about supported decision making, this was really what Michelle asked me to talk about, but I had to find a good segue. I guess I want to dispel some of the myths about supported decision making. Everyone makes decisions in different ways. At different times, we will seek out other people to help us in making decisions. We might do that for financial decisions by engaging an accountant or engaging a financial planner to give us the advice on how we might best manage our money or invest our money or whatever it might be. If it's around health issues, we will go to a doctor and seek their engagement. On an everyday level, I have no doubt, I know I do it myself, that each of you will talk to friends or family if you encounter a situation or a decision that you perhaps haven't encountered before and you want to work out what the right thing to do is. We all do it. We all seek out support for our decisions in different ways at different times. Some people experience more difficulty in making a decision, and the legal term, I guess, for that here in Queensland is actually impaired capacity. I've thrown decision making in the middle of it. But it effectively describes a state where people perhaps don't have the, or find it difficult to follow through the process of understanding that a decision needs to be made, weighing up the options of what the outcome might be in respect of that decision, communicating that decision. But it is all still and should be very much dependent on the available assistance that is available to a person to be able to do so. So going to, I guess, what's one of the jargon terms of current times of supported decision making. What does it mean? At the moment, it means lots of different things to different people. It refers to a process by which a range of supports may be provided to someone to assist them to follow through that process that I spoke to before about making a decision. It's inherent in that is around putting the person at the centre of the decision-making process, but it captures a wide variety of mechanisms, of strategies, of ways of doing business, so to speak. One of the things when we've got a project that we're working on at the moment looking at the area of supported decision making, but one of the things I said very early on in this project is that supported decision making isn't a thing. It's not something we can put up on a pedestal and aspire to and say, that's what it is, we must all do that. There's very little understood at the moment about what works for whom, how. We know that giving someone support to make a decision can be effective, but we don't have a lot of tangible evidence about what makes it effective for different people or whatever it might be. So in that respect, I guess it's an evolving understanding. It's something we're still latching onto and trying to work through. It's a process, and it's definitely something that requires a culture of change. For many people, and I dare say particularly for many people who are currently living in institutional environments, and for all the reasons that we've been speaking to today, it seems something that's quite aspirational, because for many of those people, they've never had the opportunity to make decisions. So the idea of making a decision when you've not really been enabled to do so in the past is often quite a daunting one. So I guess in our work, we've decided to turn it around. We've taken away the conceptual term that's used of supported decision making and said, let's talk about decision making support. It's something that everyone uses, so let's not make it something that's unusual, that's disability specific. Let's talk about it in a more everyday way and see if we can understand it better by doing so. So in practice, I've got a lot of little cliched remarks I'm sure that'll come through in these next couple of slides, but it doesn't have to be hard. It may take some time to teach people, as I said. But I think it starts with helping people to understand that a decision needs to be made, or when a decision needs to be made. It can be starting with some simple decision making. If we're going to build a skill, any of us, if we're going to start learning something new, we'll start at the easy end. Actually, no, not everyone. Many people will throw themselves in the deep end, but most of us would start with something simple and then build up to the more complex. There's no right way or wrong way. It's very person specific. It's about finding or knowing or understanding who the person is and what makes them tick, and using that to support them in the decision making process. For some people, that might be about using pictures. For others, it might be about using actions. For others, it might be about speech. As I said, no gimmicks required. It can start now. Often the first step, as I said, is helping a person to understand that a decision needs to be made. It's then about explaining the options, explaining the choices in a way that the person will understand. And that doesn't mean that there have to be, a million and one choices there. It might be about, in the first instance, narrowing those choices down to 2 or 3. It might be making it 2. But giving people that opportunity to go, it can be this or this, which one would you prefer? And then explaining what the benefits or compromises that might exist with each choice could be. For some people, decision-making support might be about having someone communicate their decision to others. They may well be able to make the decision, but their ability to convey that to someone may be limited. And in that instance, it might be about you being the communication partner in that. Sometimes it's about helping other people understand that a person has rights, that they have interests, that they have things that they themselves are personally invested or want to be part of. Too often, I think, people with disability continue, even in this day and age, to be lumped together as a homogenous group, rather than being a set of individuals who have individual likes, dislikes and preferences. For some people, it might be about listening to their behaviour. I'm the psychologist. This is where my psychologist hat comes on. I'm a psychologist by trade, so I've, prior to coming into some of the roles that I've worked in over the past few years, I worked directly with people who used behaviour as a form of communication. They used it to tell me that they were angry. They used it to tell me they were frustrated. They used it to tell me they were upset. They used it to tell me they were happy, and any other emotion you might come through. They used it to convey that whatever was happening in their situation right now may not have been working for them. We need to listen to that. And if behaviour is the means by which someone communicates, then we need to enable them to show or to use their behaviour to show us what they want in lieu of what they're getting. So who provides decision-making support? Ideally, everyone would. Ideally, we would all take the time to accommodate people in community. Ideally, the shop assistant would enable someone the time. If it took them longer to express themselves, they would step back and wait. Unfortunately, we live in a fast-moving world. People are like, come on, and then they start talking to the support worker next to them rather than allowing the person the time to convey or communicate. In terms of actual, I guess, that conceptual notion of decision-making support, ideally that would be provided by someone who knows the person well, someone who understands their communication style, someone who has a bit of an understanding of what their likes and dislikes are so that they can support the person down that path of making a choice if they need the assistance to do so. Regardless of who's providing it, the information that the person needs to make a decision needs to be provided in a way that the person understands. It's no use, talking about financial management plan in the usual language of an accountant if the person's level of understanding is that equivalent to perhaps a grade 3 or grade 4 level. It's about tailoring information and making sure it fits to the person. In the first instance, most people who would take on a decision-making support role would be a family member or a close friend who's part of someone's, informal network already. Where that doesn't exist, and I acknowledge that for some people who are currently living in institutions, that doesn't exist for a myriad of reasons. But where that doesn't exist, it's then looking into what options might be available outside of that, exploring the notion of citizen advocacy, for instance, but using that as a vehicle to perhaps build a network of support around the person over time so that perhaps that formal support can be phased out if that's appropriate for the person. And again, each person is case by case, so you can't, for some people that may not happen, and the citizen advocacy that's there may be the right and the appropriate support for a longer time than it perhaps would be for others. Some of the challenges in the current environment with, providing decision-making support is that there's very little, actually, in fact, really none, authority given to people in those roles. There's a little bit of it in the Commonwealth space, and our state legislation here under the Guardianship and Administration Act acknowledges that informal support can be provided, and in fact QCAT can ratify the decision of someone who provides informal support. But unfortunately that authority often goes by the wayside when it comes to the banks or to dealing with utilities providers and things like that. Often they will either require that the person themselves is the one to sign or to speak or whatever it might be, or they will ask to see the documentation that formally appoints an alternative person to do so. Those are some of the challenges that currently exist and that hopefully over time will be overcome. Certainly it's part of what we hope our work will lend itself to, is some ideas about how we can perhaps strengthen the authority accorded to people who provide support via informal means. And I also hope that the ALRC inquiry will perhaps throw some ideas into the mix in that regard as well. So handing over the reins, I guess with the provision of decision-making support and with enabling people to be part of decision-making processes that involve them comes a degree of risk. And I think we need to acknowledge that that exists and also look, but not see it as an obstacle. Look at how we work through that and work past that so that the person still can retain that decision-making authority. I guess with that, decision-making support is only part of the solution. And look, I spoke earlier to the fact that, one of the issues with moving people out of institutions is that there's insufficient infrastructure to provide the supports that are needed in community. Similarly, if we're looking at the provision of decision-making support for people and enabling people to take on more autonomy in their everyday lives, we need to make sure that the infrastructure that they need to make the decisions exists, but also the infrastructure they need to be able to do the things that they want to do. It's no use providing people with an opportunity to make decisions about what they want to do in their life if the support isn't there to enable them to actually undertake those things. So it's a balance. We need to be looking at how we build an individual skills, but we also need to look at what's needed in the sector to enable people to have real and true choice and control. One of my concerns with the NDIS, I guess, is the words choice and control strike me as becoming a bit jargonistic. I don't know, is that a word? I'll make it up. It is today. I think where the words are being used too often without truly understanding what they mean and without giving I keep coming back to infrastructure. I want another word for that. Without having, I guess, those other things around that enable people to have true choice and control. You and I know that in our everyday lives, if we make a decision, we do make it within certain constraints. If it's about, whether we can afford to go on a family holiday, we know what our finances are, we know we're limited by those, and we make decisions accordingly. What we're talking about here, though, are people's everyday lives. It's the things that, it's the basics that you and I are, just take for granted, I guess, in many respects. When I'm deciding where I'm going to take my next holiday, that's a bonus. That's not my everyday. I know that I can make a decision about what time I get up in the morning. I know I can make a decision about what I'm going to have for dinner or when I'm going to have my cup of tea or whatever it might be. Again, people with disability at the moment are limited, particularly those in institutions, are limited in the extent to which they're able to realise those things. In moving forward under the NDIS, part of what I think people need to be questioning, both individuals themselves, but their families, their friends, their supporters, the people that are enabling them or encouraging them or supporting them in the decision-making processes, is the extent to which the person is going to be able to be part of decision-making processes with the organisation that they may choose to receive their supports from. Are they going to be able to say, this is what I want, this is how I want my daily routine to run? Need to look at the willingness of the provider to have other people involved in those processes of providing decision-making support if the person themselves wishes to have other people involved. We should be looking to have documented policies, documented procedures. What does exist that says you're not, not only you're not giving just lip service to this, you are bound to this because your organisational ethos says that you must. Something you can come back to say, but hang on a minute. You gave this to me when I started with you and said this is how we roll. You need to be doing so. The kind of put your money where your mouth is kind of conversation. There need to be robust complaints systems, and that means ones that do objectively look at it. It's not just an internal system that kind of goes, oh yeah, you've said that, no, yeah, no, it's all right, we're all doing the right thing. They need to be really robust. They need to be willing to interrogate their own policies and procedures, and if they see on the basis of what's being put to them that someone's rights aren't being upheld, that they look to change those policies and procedures, not just to say, well, we did everything that the policy said. The policy might have said all those things, but if in saying those things you're still impacting or infringing on people's rights, then the policies need to be changed. There needs to be a willingness to look at that, or at least to engage with the idea of reviewing a policy or procedure to ensure that those things don't occur. The need for independence in self-audit processes. Quite often with the existing quality systems and things like that, it's really about the provider going, yep, no, we've done everything we said we should, and then a bit of a tick box process of working through that. I think there needs to be a stronger process of interrogation within those systems to go, show me, demonstrate that to me. Don't just tell me that you're doing it, show me how that happens in action. Which, as I said, leads to, I guess, those service accreditation and quality assurance processes, and the need for those too to perhaps be reviewed in light of the changing context in which we're moving now as the NDIS comes closer. So I guess the key words are don't step out, just step back. It may not be possible for everyone, but I dare say it's possible for most. It's okay for a person to make bad decisions. I know I've made my fair share over the years. We all learn from our mistakes. Most of them. Some of us go back and repeat them a couple of times and then we learn from them. But we have the right to do so, and so too should a person with disability. How do you know that that isn't going to work? How do you know that that's not possible if you don't give someone the opportunity to give it a go? Be creative. Help the person to think about the safest way to achieve what they want to achieve. It's not about throwing people to the wolves, but it is about still looking at the decisions that people make and taking them seriously. Seeing what might be possible. There's a lot of work going on across the jurisdictions at the moment looking at supported decision making. I'll go back to the old, I like decision making support. And I think those new understandings that are starting to be generated are paving the way for a cultural shift, as I said earlier. The NDIS itself presents an opportunity to think about things differently, to do things differently. I think we need to use the current environment as far as we can to push for change. We need to challenge the system. We need to use what will become the buying power of the system to challenge the market, to manipulate the market in a good way. We need to use it to give people with disability a true voice. If the words choice and control mean anything, then we need to make sure that they are actions and not just words. And to finish, and I probably actually managed to do that within time, which was pretty impressive. Let us not repeat the mistakes of the past. Instead, let us be part of changing the future.